Testing because it's a habit. All right, continuing in medical records, this chapter, chapter 8, we're going to talk about managing medical records. So the objectives of this chapter are listed: identifying settings that have medical record, reports within the medical record, recognizing deficiencies, how to manage medical records, creating policies and procedures related to medical record functions. So on page 192, it starts out with the different healthcare settings. Each paragraph reviews a different setting and what that means and what that would mean as a manager. That it is different. It's different to be a manager in a physician's office compared to an ambulatory surgery center or day surgery center. Being the manager at a local laboratory is different than being a manager at a local physical therapist or occupational therapist office or dentist. So just read about the different settings, and there's different laws and there's different codes. This chapter is not going to go into the specifics of that, but just familiarize yourself. Long-term care is mentioned on page 198. Then we go into home care, a hospital's inpatient record. So I don't know if I've said this before, but when it comes to medical records, if it is not documented, then it's just assumed it was never done in the eyes of the law, in the eyes of billing. Medicaid and Medicare, especially, health insurance companies will deny claims because you didn't document appropriately, and especially hospital inpatient records, because today's healthcare world, if you are inside of a hospital as an inpatient, you are very, very sick. There's too much ambulatory or outside of the hospital. I can't think of the word I'm trying to say. Outpatient setting, that's what I'm trying to say. Urgent cares, even simple 23, 24-hour observation healthcare facilities these days. So anytime you have, if you're a manager of an inpatient hospital setting, the documentation is very, very, well, it's critical at every setting, but especially in a hospital inpatient setting, because those people are really, really sick. And the billing is going to get very detailed, so you have to have everything. Your I's are dotted, your T's are crossed, etc. Page 200 speaks to the advanced directive form checklist. This is something that is done, I believe, at every healthcare facility these days. Even my primary care doctor will ask me about that. DNR order. So 202, we reach rules for documentation. Then it talks about the future of medical records and electronic health records on page 204, good old summary, and then here's your questions and for the quiz. And yeah, so let me know if you have any questions. I hope you enjoyed this chapter.